Hello, everyone. On behalf of Wholespire, I welcome you to Wisdom Wednesday. Participating in the Wisdom Wednesday webinars is an opportunity to learn from leading experts on topics related to healthy eating, active living, capacity building, communications, and more. Today's webinar, New and Emerging Research on HEAL, will give you the opportunity to hear from an expert in our state on some of the research that he is a part of through the University of South Carolina School of Public Health. Some of the topics that will be covered today are obesity and environmental justice, the development of a Childhood Obesogenic Environment Index and its application across South Carolina, as well as pedestrian and cyclist crashes across South Carolina. We hope that hearing about this research will help grow your understanding about environments that support healthy behaviors and how we might address them in our state. This webinar is brought to you by Healthy Blue SC, the official managed care organization of Wholespire. I am Kelsey Sanders, the Community Relations Manager with Wholespire, and I will be the moderator for this webinar. At this time, I'd like to introduce and welcome our presenter, Dr. Andy Kaczynski. Dr. Kaczynski's research focuses on healthy community design and important health outcomes such as physical activity, obesity, and mental health. He is a co-investigator with the USC Prevention Research Center and director of the Built Environment and Community Health, or BEACH Laboratory. In the BEACH Lab, he and his students study how the communities in which we live, work, learn, pray, and play affect the health and well-being of residents of all ages. In addition, Dr. Kaczynski's research adopts an environmental justice approach to examine whether different population segments or geographic areas have equal access to positive resources, such as parks, or protection from negative amenities, such as fast food restaurants. Overall, research in the BEACH Lab aims to develop tools, systems, and environmental and policy interventions that engage community members and other diverse stakeholders in building neighborhoods and communities that promote physical activity, healthy eating, and obesity and chronic disease prevention. At this time, I'm going to turn it over to Dr. Kaczynski to share his presentation.
Thank you very much, Kelsey. I appreciate that lengthy introduction. And very excited to be here today. I'm really excited to share a couple projects that we've been working on in the Arnold School of Public Health and the BEACH Lab. And I've kind of just titled this in Obesogenic Environments and Active Transportation Crashes across South Carolina, looking at things from an environmental justice perspective. I thought I might start just telling you all a little bit about me. I'm originally from Canada, so the part of Ontario that dips down into the US a little ways near Detroit and Buffalo area, but I grew up in a small town called Woodstock, Ontario, went to the University of Waterloo for my undergrad and my PhD. But I've been in South Carolina for over a decade now and absolutely love USC, go Gamecocks, and Columbia and our great state. Been really enjoying getting to know the people and places all across South Carolina over the past 10 years or so. My research and teaching focuses primarily on policy and environmental influences on physical activity, healthy eating, and obesity prevention. We do all of that through our Built Environment and Community Health, or BEACH Laboratory. Tell you a little bit more about that in just a moment. And on a personal note, I have three amazing daughters, the oldest of which is actually a sophomore at USC. And in my free time, I try to be as active as possible, playing tennis, working out, and so forth, but also balance that off a little bit with a few visits here and there to some of our amazing breweries around Columbia. Everything in moderation, I guess. So today, I want to just provide a little bit of background about obesity and environmental justice as a framework for some of the projects that we'll discuss today. But I want to spend the majority of our time talking about two projects that we've been working hard on over the last several years in the BEACH Lab. One is the development of a Childhood Obesogenic Environment Index. We actually did this at the national level, but I want to tell you about how we can apply it across South Carolina. And then the second project is in collaboration with the South Carolina Department of Transportation, looking at pedestrian and cyclist crashes across South Carolina and whether differences exist in census tracts by social vulnerability level. So our BEACH Lab is part of the Arnold School of Public Health, been established since 2012. And we work with a variety of local, state, and national partners across South Carolina and across the United States. So for example, some of you might be very familiar with our work, might hopefully have been partnered with us even in the past. We've worked with organizations such as Live Well Greenville, doing a variety of grants and projects looking at parks and food environments and so forth across Greenville County. We worked with Wholespire in the past, developing the Healthy Young People Empowerment Project. We've worked with some national partners, such as the Trust for Public Land and the National Recreation Park Association, now doing this project with another state partner, the SCDOT. So really enjoy trying to make sure that our research is very applied and practical. It can be used by folks around the state and country. And then we also collaborate a lot with various faculty partners within the Arnold School of Public Health and across campus and across other institutions in the state. And we have a variety of doctoral, master's, and undergraduate students who all contribute to these research projects. And in general, we focus on how policies and environments affect physical activity and healthy eating. As you might guess, that's primarily because we're very concerned about obesity rates in South Carolina and beyond. So things are obviously not the greatest when it comes to obesity levels. In South Carolina, this is a map of all of the different counties, our 4 to 6 counties, and the best percentages we have are with about 1/3 of adults falling into the obesity category. And sometimes in some counties, it ranges all the way up over 40%, almost to 50%. So I think there's a lot of work that we can do. Of course, there's many different causes of obesity, and we're going to take a look at some of those, but we try to address things from an environmental perspective primarily, and looking at how the resources that are available to people might be contributing to some of these negative health outcomes and situations that we see. Of course, as you may know, obesity is created by an energy imbalance. So if we have low dietary restraint, meaning you're consuming a lot of calories, or low physical activity levels, then you're more likely to be afflicted by obesity. So at the top of this graph, we see the highest likelihood of obesity is when we have low dietary restraint and low physical activity. If we can improve at least one of those behaviors, then we'll have only a moderate levels of obesity. So if we can have high dietary restraint or high physical activity, and the best case scenario, of course, would be if we can promote both of those. Fewer calories consumed because people are consuming healthier foods and more opportunities to be physically active, then we'd find ourselves at the bottom of the chart where the likelihood of obesity is the lowest. And there's lots of different ways, as I've said, to tackle obesity, but I think that, looking at the environments around us is a good place to start, because we can make all the personal choices we want to be healthy, but if our environment doesn't really provide the resources or the settings that will allow us to make healthy decisions when it comes to physical activity and healthy eating, then it's certainly going to be a challenge for almost any of us. So I really like this quote that says, most of the communities where Americans live, I'd say that's true for Canadians as well, are important contributors to current public health problems, unfortunately. But I like to look at more of the positive side of this, and that says that simultaneously, they can also be the source of important solutions to these problems. So I think we've done a lot to sort of mess up our communities and our urban planning and our neighborhoods over the last 50 or 60 years. But I think there's a lot of potential to address the obesity crisis by starting to look at some of the policies and environments and how we can improve those to improve physical activity and healthy eating. Of course, when we do that, we really want to think about all of these issues from an environmental justice perspective. A lot of you are probably familiar with this term. Environmental justice, from my reading of it, has sort of two primary elements or components to it. The first one is what we often think of, that there's fair treatment or equal protection from positive and negative things. So I want people to have equal access to parks and maybe protection from fast food restaurants or crime or other negative things like that. And so I think, though, that's really important. And then the second part, though, I think that is equally important is the meaningful involvement component of environmental justice. So it's not just about people who work in urban planning or in parks and recreation or public health bringing about those changes on behalf of the people who might be affected by the different neighborhoods and communities, but also trying to engage the people who are part of those neighborhoods and communities to be a part of the positive change. So a lot of what we try to do in the Beach Lab as well, I don't know if you'll see it reflected today necessarily, but is developed tools and data and so forth to help decision makers and help communities and neighborhoods make decisions about the ways they want to improve physical activity and healthy eating environments and policies within their own neighborhoods and communities. So let's talk about a couple projects we've been working on for the last several years, and hopefully you'll see how some of this research gets applied across South Carolina. So the first looks at obesogenic environments in counties across South Carolina. So the obesogenic environment, by definition, is the sum of influences that the surroundings, opportunities, or conditions have on promoting obesity in individuals or populations and focusing on that environmental level for obesity risk. So kind of like, you know, how does our neighborhoods and our communities and the places that we spend most of our time influence the opportunities that we have to be active or to be physically or to eat healthy. And an obesogenic environment would be one where it makes it more challenging to be physically active or to find healthy foods. So obesogenic environment is kind of a negative term, and you'll hear me use it in that way as we progress through this section of the presentation. So our sort of motivation here was to look at childhood obesogenic environments in particular, because we want our children to have the opportunities to grow up in environments where they can develop healthy behaviors when it comes to physical activity and healthy eating. And there weren't really any large-scale measures that existed for characterizing obesogenic environments, those environments that might be conducive to promoting obesity and making it more challenging for people to be healthy and to eat healthy and to be physically active. And we were also really interested in looking at, you know, are these environments going to be worse or better in low-income areas and high racial and ethnic minority areas and in rural areas? And this project was actually funded by the Federal Office of Rural Health Policy. And we were interested in developing an obesogenic environment index and going through the steps for that. And then also looking at these scores across South Carolina. And then, of course, looking at, you know, do we see different scores when it comes to these different demographic and geographic variables? So to do this, we pulled together data from a variety of different sources. The first was we were looking at this at the county level. So as you may know, there are over 3,000 counties across the United States. In South Carolina, we only have 46, and I'll get to that in just a moment. But we pulled together for all of the counties across the country. We also wanted to look at census data about income and race and ethnicity, and I'll speak more about that in a moment. And then we also were categorizing counties as either metropolitan, micropolitan, or rural. Metropolitan being closer to large cities, micropolitan being closer to small cities, and rural being, as you'd expect, not really close to any sort of a city or any sort of a town. And then we also were characterizing the food and physical activity environments in all of the counties across the country using data that was publicly available from different sources. And I'll tell you more about that in just a second. And so one of our big jobs to start this project was to decide, well, if we were going to measure an obesogenic environment, what kinds of things would we want to track to go into a score for a particular county? So I won't bore you with all the methodological details here, but we went through an extensive process of looking at the literature and trying to figure out, you know, what kinds of things does various research studies say about what promotes physical activity or hinders physical activity in kids, what helps or hurts healthy eating or obesity levels within youth. And so we looked at about over 20 different review articles that kind of gave us about, I think it was 124 variables that were candidates to include in the index. We then talked to different experts who were knowledgeable about physical activity or healthy eating or youth or built environments and so forth. And they helped us to narrow in on 24 different variables. And we also looked at the availability of data. Could we actually collect data on a wide scale for an entire state or for across the entire country about these different variables? And then we had some more extensive discussion amongst our research team that had lots of expertise in physical activity, healthy eating, and geography and measurement and so forth. And eventually we narrowed it down to 10 different variables and obtained those for all 3,142 counties across the country. So those 10 variables included 6 related to the food environment. So 5 of those, the first 5 listed here, are available from the United States Department of Agriculture, and they look at the different types of food outlets per 1,000 county residents. So the number of grocery stores per 1,000 residents, the number of farmers markets per 1,000 residents in the county, and then some more negative things, the number of fast food restaurants per 1,000 residents, number of full service restaurants, and the number of convenience stores. And we also had one more variable in there that was a little bit different, looking at births at baby-friendly hospitals, because that can be a strong indicator of breastfeeding support, which is highly related to the development of obesity in infants and younger children. So we had those 6 food environment variables. And then we had 4 that were related to the physical activity environment. So access to exercise opportunities, parks and recreation facilities and so forth. This was taken from the county health rankings. So some of you might be familiar with that data source, but they provide a value and a score for every county for access to exercise opportunities. Also from county health rankings, we looked at violent crime. So the number of violent crimes reported in the county per 100,000 population. The CDC the EPA has the Environmental Protection Agency's National Walkability Index that looks at how walkable is a census block group. So we aggregated all the census block groups within a county up to the county level and got a score for the county on its walkability level. And then we also looked at all of the schools existing with the county and what percentage of the population within the county lived within a half mile of a school as an indicator of whether kids would be able to walk to their school or not. So taking those 4 variables, we kind of had a measure of the physical activity environment as well. And so for each of those variables, we kind of lined up all of the counties across the country, or in South Carolina, across the state, and we ranked them from best to worst. And so if you were in the worst county, you would get a score of 100, meaning most obesogenic. If you were in the best county, you would get a score down closer to 0. And then all of the counties would fall somewhere along those percentiles from 0 to 100. And then we reverse scored any of the positive features, of course, because if you're a grocery store, that's a good thing. And so we wanted to reverse those so that all of the final scores meant that high values were worse obesogenic environments. So I want you to remember that as we go through the scores today for different counties and different variables, that in all cases, a higher score means a worse environment or more obesogenic environment. And all we did simply was take the 10 scores for each of the 10 variables for a county and average those together, and you'd get a score for the entire obesogenic environment across all 10 variables. So you could be high on some variables and low on others, but overall, we'd get a score for the entire county by averaging the 10 variables. So this is what the country looks like when you take the overall obesogenic environment for all of the counties in the country. And I think you can see some interesting trends here. And so again, looking at the legend in the bottom right corner, red values are worse, meaning higher scores. Blue values are lower, meaning better scores and better obesogenic environments. And I think you can see some patterns that, in the southeast of the country, we have a lot of higher red scores, unfortunately, where obesogenic environments are more prevalent. Out in the Northeast in California and maybe in the middle towards like Colorado and so forth, we see some more positive scores, more in the blue range and so forth. So I think it's kind of interesting, and I think that overlays nicely or corresponds very well with a map of obesity when we look at obesity rates across the country. And if you're interested, this is what the physical activity environment looks like. Pretty similar, some similar patterns, but it'd be interesting to look at each individual county, and we'll get to that for South Carolina in a minute, as to whether it's high or low when it comes to physical activity, or the food environment as well. The food environment's a little bit more mixed across the country. We see some more balance of the positive and negative areas across the US. So you're probably more interested in the South Carolina environment, though. This is what it looks like when we take scores across South Carolina and we break them into 4 groups. So again, blue being our better counties with scores ranging from about 39 to 48, and the red being the worst counties when it comes to the overall obesogenic environment with scores from about 57 to 63. And then yellow and orange in the middle as well. So you can see that, there's a wide diversity in South Carolina. Some counties having fairly positive scores, some counties not doing so well when it comes to the food and the physical activity environment combined. And I think maybe you can see some trends that, down the I-95 corridor that we often talk about, we see a little bit more orange and red up towards the north areas of the northern rural areas of the state. Overall obesogenic environments are a little bit worse. But what some of the takeaways I want everybody to take from this are that, things are not equal across the state, and that there's different places where we might need to invest different amounts of energy in the overall environment or the food environment or the physical activity environment. So what I've done here is just highlight 5 counties, the counties with the highest scores and the counties with the lowest scores. So you can see the 5 counties listed there that had the overall highest obesogenic environment scores, meaning the worst scores. And then in the bottom of the slide, the best scores. And so, again, not to highlight or to blame any particular counties or cast any shame on anybody, but, things are a little bit different as we look across the counties in South Carolina, and we really want to pay attention to that and try to focus efforts and resources where they are necessary in order to try to improve food and physical activity resources that are available to people. If we look at physical activity specifically, you can see that the scores, again, vary pretty widely. A lot of the urban areas have some of the better physical activity environment scores up towards Greenville and York County, where Rock Hill is, and towards the Midlands and down towards the coast and so forth, whereas rural areas are a little bit more poorer scores when it comes to the physical activity environment. However, if we go to the next slide about the food environment, actually, sorry, we'll get to that in a minute. Here's your top 5 and your bottom 5 when it comes to the physical activity environment. Again, like I said, on the bottom part of the slide, some of the more urban areas have the better physical activity environment scores, and some of the other ones are not doing so well when it comes to, again, remember the resources that we talked about that were part of that were access to exercise opportunities, crime, walkability, proximity to schools, and so forth. But when we look at the food environment, again, it's a little bit more mixed. We see that the positive environments, the blue on here for food, are spread a little bit more evenly across urban and rural areas and east and west across the state. And we actually see some of the urban areas are not doing so great when it comes to our food environment metric, partly perhaps because of a substantial number of fast food restaurants and convenience stores and things like that, or these food swamp kinds of areas where people have a lot of access to unhealthy food options. So you can find your own county as we go here. And if you look at the top 5 and the worst 5, again, they're kind of spread all over the state, but there's a lot of diversity in the scores that we see when we break it down into both the food environment and the physical activity environment. So this is just a summary of the last several slides that we showed, the least obesogenic environment counties overall, and for the food environment and for the physical activity environment. And what I think you can take away from this is that, and I'm happy to share, I'll say this again later, but we're very happy to share all of the data for each county and to see what does the food environment look like in your particular county, or what does the physical activity environment look like. And I think what you'll find is that most counties have some work to do. They might be great when it comes to the physical activity environment, or they might be great when it comes to the food environment, but there's very few counties that are really highly ranked when it comes to both of those. So there's a lot of work to be done, I think, in most counties on one aspect or the other, or in some cases on both. So you can see here, though, the best and worst counties when it comes to overall environment, the food environment, and the physical activity environment. Now, we did want to investigate some of these things by some demographic factors. So does it differ when it comes to income levels? So this is the same map we saw earlier about the overall childhood obesogenic environment, but we've also overlaid any of the counties that were classified as lower income, meaning the bottom 1/3 of counties in South Carolina, we put into the low income category. And so you can see a fair bit of overlap between lower and middle income counties when it comes to a lot of the orange and the red on the map. And if you look at the actual numbers, we have higher values, meaning more obesogenic environments for the low income and the middle income counties compared to the higher income counties having somewhat better scores when it comes to the obesogenic environment. Physical activity, it's a similar pattern. The lower income counties have by far the worst physical activity environments, and it gets progressively better as you go up to the higher income categories. But food environment looks a little bit different. You've got lower income counties having lower scores, meaning better scores when it comes to the food environment, so less obesogenic, whereas the middle income and the high income counties are actually have similar scores, around 47 or 46, when it comes to the food environment. So kind of interesting there. We also wanted to look at it by race and ethnicity. We don't see as many differences here. So this is the percentage of people in the county that are that are non-Hispanic white. So low white, moderate white, and high white. And when you break it down like that, you don't really see too many differences in the obesogenic environment scores. The low percentage white has slightly higher overall obesogenic environment scores at 54, but not a huge difference across the three categories. But you do see a bit of a difference when you look at the physical activity environment. So more obesogenic environment scores at 72 in counties that have a low percentage of white population, whereas counties that have a higher percentage of white population have a better obesogenic environment score when it comes to the physical activity environment. But the food environment is a little bit more mixed. So we have lower scores, better environments in low white and moderate white areas, and a little bit worse when it comes to the higher white areas, which is kind of interesting. And then lastly, by rurality, not huge differences here, but rural areas have somewhat worse obesogenic environments overall. You can see that that's highlighted here, and some of the numbers bear that out. And especially when it comes to the physical activity environment, much higher, much more obesogenic environment scores for the physical activity environment in the rural areas versus the micro, or especially the metropolitan areas. But in the food environment, the rural areas actually doing a little bit better. Again, perhaps because they have more grocery stores per 1,000 population. Whether those are ideally located or not is another story, but overall the ratio of food outlets, positive food outlets to population served compared to negative food outlets to population served is a little bit better in rural areas compared to micro or metropolitan areas. So just as a way of bit of summary, relative to the rest of the country, unfortunately, many South Carolina counties have worse obesogenic environments. So there's a lot of work that we have to do to improve both the physical activity and the food environment in South Carolina. And I think we want to pay particular attention to certain areas that overall, there were some trends that obesogenic environments were a bit worse in lower income areas, in higher minority areas, and in rural counties. Different degrees of concern there, but I think we want to pay attention to these environmental justice type issues. And there are major variations across counties when it comes to the total environment, but also, as I mentioned earlier, the physical activity environment and the food environment. So it's really interesting to look at for a particular county. Is it doing well when it comes to the food environment, physical activity environment, the overall environment, and where do we need to exert a little bit more effort for particular areas? And as I mentioned, full data are available for the food environment, the physical activity environment, the individual variables. We are very happy to share all of that. And I think it would be useful to look at where your county falls and how does it compare to other counties and what are the areas where we need a little bit more effort and so forth. Because I think it's going to take a lot of innovative and sort of comprehensive, multi-sector, multidisciplinary, lots of partnerships, those kinds of solutions in order to improve the physical activity environment and the food environment and tackle something as complex but as important as obesity. All right, so I'd like to move on to a second project that I think has some environmental justice implications as well, but is very different when it comes to topic-wise. One of the ways I think we can promote physical activity in different counties and cities and towns and across the state is by making transportation safer, making it easier for people to walk and bike to different destinations, whether that's school or work or shopping, or even just for fun to go to the park or to go out for a walk or a jog with your dog or whatever. But unfortunately, there's a lot of safety issues that exist. And so we wanted to look at pedestrian and cyclist crashes across South Carolina. And again, from an environmental justice perspective, are there differences by this idea of social vulnerability, which I'll explain more in a moment. So there's our study team for this one, myself and a number of fabulous students that we've worked with, all making substantial contributions to the project. And we have a number of collaborators as well. Dr. Armstead from psychology, Dr. Ortaglia from epidemiology, Dr. Hune from engineering, and Drew Stokes, who's with the South Carolina Department of Transportation. And our impetus for this was that, unfortunately, pedestrian deaths and cyclist deaths are climbing in the U.S. So these numbers are for the entire country initially, but over 64,000 people killed while walking and over 10,000 killed while cycling over the past decade or so. And this is especially problematic in certain areas and certain populations across the country. So in the Southeast, it's especially bad amongst certain vulnerable populations, older adults, people from racial and ethnic minority backgrounds, people in lower income communities, much more affected by the levels of pedestrian and cyclist crashes. And obviously, if you don't feel safe walking or biking, then you're much less likely to engage in active transportation. That's going to lead to higher levels of physical inactivity. That's going to lead to more obesity and more chronic disease. And so if these types of issues are especially affecting certain areas or certain populations, then it's perhaps not surprising that these are the groups that we see are suffering more from a lack of physical activity and higher rates of obesity and diabetes and cancer and so forth. So I think we really want to be conscious of the issues related to environmental justice and the related concept of deprivation amplification. This idea that people who have lower personal resources to engage in healthy behaviors often find themselves with lower poorer environmental resources as well, that kind of amplification of the deprivation. And all of that has serious implications for not only our physical health here, but also our social health. Can we get out and get around and take part and be active within our community and get to know our neighbors and build our social capital and all of that? And our mental health as well, right? Physical activity and being an active part of your community has serious implications for mental health and depression and issues like that. So all of the things we're talking about today are not just about obesity necessarily, but they can have a positive impact on a variety of different issues. But our primary question in this part of the project was, are crashes more likely to occur in socially vulnerable neighborhoods? So, or maybe are they equally distributed? But we had a hypothesis that, in neighborhoods that were more socially vulnerable, are we more likely to see pedestrian and cyclist crashes? So neighborhoods in this case were defined by census tracts across South Carolina. You can see pictured here, there are over 1,100 census tracts. Using the definitions that the USDA provides, 889 are classified as urban, meaning they're partly somewhat close to a town or city, and 213 are classified as rural, or 20%. But overall, we've got 1,100 census tracts that we wanted to examine data for. And for each of those tracks, we pulled together some data about social vulnerability using the CDC's Social Vulnerability Index. And what this is a statistical tool that's used to rank or measure the susceptibility of communities to various hazards, disasters, and adverse events resulting from social, economic, or environmental factors. So if you were some sort of a disaster or a concern or an issue that occurred within the community, how ably could that community or that census tract respond, and how socially vulnerable are they to these different adverse events? And the Social Vulnerability Index is comprised of 15 different variables that are spread across 4 different dimensions. So I won't go into all of them here, but 4 of them are related to socioeconomic status, the percentage of residents below poverty, percentage unemployed, the income level of the tract, and the education levels. Household composition and disability is made up of older people and younger people, civilians with a disability, single-parent households. Minority status and language is comprised of the percentage of minority residents and people who speak English less than well, and then some housing type and transportation variables about vehicle access and percentage of people who are renting and so forth. So take all those 15 variables and squash them together, measured for each census tract, and you have this indicator of social vulnerability. And so if you're interested, this is what social vulnerability looks like across South Carolina, with lighter colors like yellow and green being lower social vulnerability, and higher values being the teal and the darker blue being greater social vulnerability or more vulnerable. And then we wanted to pull together data about all of the crashes in South Carolina to try to understand, well, where are these crashes happening and who's involved in them and so forth. So we had over a decade's worth of crashes that were collected by the South Carolina Department of Transportation. So anytime some sort of a crash happens and it gets documented by the police, then it goes into a database, and there's all kinds of information that gets attached to that crash, like who was involved and various demographic characteristics about them. What was the location of the crash? Was there a pedestrian or a cyclist involved? What was the level of severity when it came to the crash? Was it just like property damage? Was there an injury? Was there a death? And so forth. So we took all of the location information and geocoded all of the crashes and assigned them to a census tract. So basically putting every crash on the map and then attaching it to its particular tract, depending on where it occurred. And we also looked at, for each crash, this thing called the EPDO, the equivalent property damage only value, based on, was there only property damage, or was there an injury, or was there death? And so as you get closer to the death end of the spectrum, of course, you have higher scores for the damage score for the particular crash. So if there was a whole bunch of crashes that had injuries or death within the particular tract, then that tract would have a higher crash severity or EPDO score. because it's important not only to look at the number of crashes, but the types of crashes that are happening and whether they're causing major injuries and death, unfortunately. So we had a score where we wanted to evaluate how many crashes were happening within a tract, or what was the total amount of severity of those crashes. But as you might imagine, in some of our more urban tracts, there's probably much more walking and biking happening simply because there's more people living there, or more people trying to get from point A to point B. And so there's a much greater likelihood of people getting involved in pedestrian and bike crashes if there are more people there and more people moving around. So there's a data source called Streetlight that was used to estimate the number of walking and biking trips that happen in each census tract on an annual basis. So what we did is we took the number of crashes, or the total amount of crash scores, crash severity that was happening, and we adjusted that based on the number of trips that were occurring. So a census tract could have a large number of crashes, but if it also had a large number of trips that were happening, then the crash score might not look quite as high. So if you had two tracks, one had 35 crashes and another had 35 crashes, but there was a greater number of trips that were happening in one particular area, then its score for crashes per trip would be lower. Whereas if you had a lot of crashes, but not many trips happening, then that would be obviously a really bad area where they're having more crashes per trip that were happening there. So we're just kind of adjusting things based on the prevalence of active transportation that's occurring in each tract. So just to look at the raw numbers, though, first of all, in South Carolina over that time period, over that decade or so, there was 16,600 total crashes that occurred. Those are broken down into about 2/3 pedestrian and 1/3 cyclist crashes. So more pedestrians, probably not surprising. There's generally more people walking than biking. But if we look at the average number of pedestrian crashes per tract, so across the 1,100 tracts, it ranged from 0. Some tracts had absolutely no pedestrian crashes, which was great, all the way up to the highest was an average of not the average, but a total number of crashes. Some tracks had 97 pedestrian crashes, but on average, there were 9.7 pedestrian crashes per tract. The number of cyclist crashes ranged from 0, some in one tract, all the way up to 133 in another tract, but the average number was just over 4 per tract. But if you look at it on a per trip basis, there are more overall pedestrian crashes per tract, but on a per trip basis, there are more cyclist crashes per trip. Not as many cyclist trips are happening, but there are still a fair number of cyclist crashes happening. So for the number of biking trips that are being made, there's actually a higher rate of biking crashes than there is pedestrian crashes, which I thought was kind of interesting. And if we look at the total severity of crashes that are happening in each tract, the scores range from 0 all the way up to over 13,000 for pedestrian crashes, the total amount of injury and damage and everything that was happening, with an average of 1,400, or for cyclists, an average of 317. But again, if you look at it on a per trip basis, there's actually more damage that's being happening per crash when it comes to cyclist crashes in tracts across South Carolina. So I point that out partly because I think it's very important to pay attention to both pedestrian and cyclist crashes, because there's more pedestrian crashes that are happening, but the cyclist crashes are happening a little more frequently relative to how often people are biking, and there's a lot of severity that comes along with them as well. We also wanted to look at, how does this break down? Like, who's getting involved in these crashes? So you can see some pie graphs here that show the breakdown by race, gender, and age when it comes to active transportation crashes overall. So this is the total of bike and pedestrian crashes. We see that 68% of active transportation crashes happen amongst people who identify or were coded as white. But the percentage of folks who are white in South Carolina is actually a little bit higher than that, whereas in Black, sorry, a little bit lower than that. Black actually is 27%, and the percentage of folks who identify as Black in South Carolina is a little bit lower. So the point I was trying to make here is that people from African American backgrounds are more likely to be involved in crashes than their representation within the population. The same thing occurs for males. 72% of folks who are involved in crashes are males, whereas South Carolina, the percentage of male-female is about even, 50-50, but we have a higher percentage of males. And then when it comes to age groups, generally have pretty even split across the 10-year age groups there, but some groups, generally our younger age groups, are more likely to be involved in active transportation crashes, folks that are 30 and below or so. So that was kind of looking at it more on an individual level, not on a tract level. And we can break that down by pedestrians as well, crashes. It's kind of some of the same types of data that you see, maybe even worse for certain groups, African American and male in certain age groups. And same thing for cyclist crashes as well. Certain groups more represented in being involved in crashes more, unfortunately, than their representation within the population. Now, again, back to census tracts, though, we were really interested in like coding where are these crashes happening, and are they more likely to happen in areas that have higher or lower levels of social vulnerability? So before we get to that question, first wanted to show just where are pedestrian crashes happening in general. So on a per trip basis, on a relative basis, these are the areas of South Carolina that are worse for pedestrian crashes. So the darker colors being higher values of pedestrian crashes per trip. And so we see that it's kind of spread out across South Carolina, but there are some areas that are much greater danger zones, whereas the yellow here is the lowest and the light green colors are the second lowest and so forth. But again, like what I'm trying to emphasize partly is that things are not equal across the state. And there are some areas where we see more pedestrian crashes on a per trip or per capita basis than others. And we might want to pay attention to those when it comes to trying to address some of these environmental justice type issues. Same thing for cyclist crashes per trip. There's a lot of disparities. Some areas are not so bad. Some areas are pretty problematic when it comes to, on a per trip basis, the number of cyclist crashes that are occurring. We can also look at that based on crash severity. So this is pedestrian crash severity. The red and darker orange census tracts have higher levels of pedestrian crash severity per trip. So where people are getting in more accidents and it's causing more injury and death and damage and so forth. But lots of differences across the state. And then likewise for cyclist crash severity, where are those areas where we're seeing a lot of issues and a lot of damage, but also injuries and deaths and so forth. So our question though was, how does this look according to social vulnerability? So a while back, I showed the map of social vulnerability across South Carolina. So essentially all we did was overlay for each tract, is it high, medium, or low when it comes to social vulnerability, or what was its social vulnerability score, and what was its score when it came to pedestrian or cyclist crashes. And what we found was that, especially in urban areas, the level of social vulnerability was positively and significantly related to the number of pedestrian crashes per trip. That was our first finding. And so what that means was that as social vulnerability goes up, the level of social vulnerability increases, the number of pedestrian crashes per trip also increases. So if you're higher in social vulnerability, kind of worse off when it comes to social vulnerability, more likely to have pedestrian crashes. Kind of unfortunate. Likewise, the level of social vulnerability goes up. I think I have a small typo here. That second line is supposed to say cyclist crashes per trip also goes up. So if you have more social vulnerability, more cyclist crashes as well, unfortunately. And the same thing we see, same patterns we see for crash severity as well. If you have higher social vulnerability, more likely to have crashes that are involving pedestrians that have a high level of damage and injury and death and so forth. Likewise for cyclist crash severity too. So really unfortunate. Now, this one, interestingly, was only in urban census tracts, whereas we didn't see any relationships between social vulnerability and crash frequency or crash severity for either pedestrians or cyclists when it came to rural areas. So I think that was interesting finding, and we have to dive into that a little bit deeper. But especially in urban areas, as social vulnerability gets worse, we see worse outcomes for pedestrians and cyclists, unfortunately. And here's a couple maps to just display some of that. On here, the darker green and blue areas are high social vulnerability. And then what we did was overlay with dots 3 categories of pedestrian crashes per trip. So the smaller dots are where there's not as many pedestrian crashes per trip, whereas the larger gray dots are where there's a much more higher likelihood of pedestrian crashes per trip. And if you look at it closely and you spend some time looking at it, you'll see that the middle-sized and larger dots are much more likely to be found on the areas that are higher in social vulnerability, the darker green and the blue. And some of the statistics that we ran kind of showed that on a statistical level, that we've got a strong correlation there between social vulnerability level and crash level for pedestrians, unfortunately. Same thing for cyclist crashes as well. The larger dots will be found generally on the areas that are higher in social vulnerability. So again, we want to pay attention to some of these areas and some of the patterns that we are seeing. So just as a way of summary for this project, more social vulnerability, unfortunately, seems to equate to more pedestrian and cyclist crashes, but that wasn't the case in rural areas, which was positive to see. But we need geographically and demographically targeted intervention and policies to try to address the crash frequency and the crash severity, and hopefully try to improve the areas that need the help the most. And I think these data, provide a nice foundation for both future research, future investigations, and future action to try to improve pedestrian and cyclist safety and address environmental justice issues that unfortunately are present across South Carolina. And just as one parting thought that I wanted to share with everybody, we can approach this in a variety of ways, and all of these are very useful and noble solutions. The first might be equality. And this is the idea that, everybody is going to benefit from the supports that we can provide. So, for example, if we can provide parks in every neighborhood, no matter the types of neighborhoods, or sidewalks, or equal protection from fast food restaurants, or other things like that, then that's equality. And I think that's great, that we want to make sure that everybody has equal access. But as the graphic here displays, not everybody kind of starts from the same point, right? Some people might be shorter, if you will, or some people might be a little bit more disadvantaged, not have the personal resources that would allow them to benefit from that equality that's being provided. So the next approach would be equity, trying to raise certain groups up so that we can overcome the obstacles that those individuals or groups or communities or neighborhoods might be facing, so that the outcomes are equal, not the equality that we're providing is equal, but that the outcome that everybody's receiving and the resources that they have available to them, when you combine sort of personal and environmental resources, are equal. But I think the best approach, of course, would be to try to address things from a justice perspective, removing the barriers in the first place, improving crime, making things safer, making people have equal access and all around to healthy food resources and physical activity resources and so forth. So I think any of these approaches are great, but I think we should strive to try to promote environmental justice and address physical activity and healthy eating barriers so that everybody can benefit from a public health perspective. So that's my summary for today. I appreciate everybody's attention. You can find some contact information there if you're interested in checking things out more. And thank you very much for listening to our presentation.
Thank you so much, Dr. Kaczynski, for that great information. I learned a ton. I wrote down new data resources, things I need to do some more follow-up on. So thank you so much for just sharing all the wonderful research that you guys are doing. It definitely resonated with me that this is a place where we can go to begin to think through where should our resources go, where should our energy go when it comes to addressing some of these environmental factors. And so hopefully those of you who do get to watch this, this will be a place that you can kind of gather that information and maybe challenge you to think about where are you putting resources in your community and are we being thoughtful about that? So also want to reiterate something that you mentioned, Dr. Kaczynski, which is that this data is available for your county. So that's Dr. Kaczynski's email right there. If you are interested in that, I think that would be outstanding for community coalitions and organizations who are working in this space of physical activity and access to healthy food to have that data to help drive those decisions. So encourage y'all to take advantage of that opportunity. And then one quick question for you, Dr. Kaczynski, you mentioned that a part of the work that you do with Beach Lab is to create resources, I believe, some things that might help with making decisions and things like that. Can you tell people where to find that information?
Yeah, so I mean, we're actually working, and all of you might be thinking about this as a next step. We haven't quite gotten there, but I'd like to make this actually, especially for our South Carolina counties, but maybe even nationwide, an interactive resource where people can find the information about their own county, maybe find the individual scores for each of the variables, or look at how does my county rank when it comes to the food environment or the physical activity environment. We haven't gotten to that point yet. We need to put a little bit more effort into that. Up till now, it's been about compiling the data and starting to understand where are some of these differences and so forth. But for now, you'd probably have to reach out to us, and we'd be happy to work with your county or provide some of the data that are available. But I think it'd be really nice to have a nice interactive map and resource and something. Maybe that's something we can partner with Wholespire on in the near future.
Absolutely. Yeah, absolutely. So more to come. But this has been fantastic. So thank you again for your time today.
Thank you.
And for those of you who watch this, if you are interested in anything else, educational resources when it comes to healthy eating and active living, you can check out our on-demand library at wholespire.org and learn lots more. But that's it for us. Thanks so much.
Thank you.